Welcome to the Deep Dive. Today, we're jumping into something huge. AI in U.S. healthcare.
Yeah, it's really moving fast now.
We've gone through a ton of material research reports, articles. Our mission to pull out what you really need to know, like what is this AI stuff in healthcare really? How's it being used now?
And how jobs are changing, right? For doctors, nurses.
And for you, what it all means.
Hmm.
And let's be clear up front.
Uh-huh.
This isn't the sci-fi robot takeover story. The sources point to AI as more of a partner.
A tool, really, to make things smarter, maybe more efficient.
And hopefully, more human-focused in the end. Okay, so let's strip away the jargon. AI in healthcare, what is it basically?
Well, at its core, it's about machines learning from enormous amounts of data.
Like medical images, patient records.
Exactly. Millions of them. Plus research papers. It finds patterns humans might miss or, take way longer to spot.
And it understands language, too. Like doctor's notes, that's NLP, right?
Right, natural language processing. And it can see things in scans, that's computer vision.
Yeah.
Think of it as a really, really good pattern spotter.
Designed to help the experts, not replace them.
Precisely. It augments human skill. And because it's good at that, it's already out there.
Okay, so where? Give us some real-world examples happening now in the U.S.
Sure. Cancer detection is a big one. AI is like a second pair of eyes for radiologists.
How so?
Companies like ADOC, their AI scans images before the radiologist sees them sometimes. It flags things.
Like potential problems? A nodule, maybe?
Yeah, or brain bleeds. Things needing urgent attention. It helps them prioritize. Find that needle in the haystack, but faster.
Okay, that makes sense. Finding the urgent stuff quickly. What else?
Pathology is another area. Analyzing tissue samples.
Traditionally very manual, right? Looking through microscopes.
Very. Now you have platforms like PathAI mentioned in the sources using machine learning. They analyze slides looking for cancerous cells. It promises more accuracy, more consistency, and definitely speeds up diagnosis, reduces errors.
That speed and accuracy seem key. The sources also mentioned mental health. That feels different.
It is, but it addresses a huge need. There's a shortage of mental health professionals, long waiting lists.
Yeah?
So AI-powered chatbots and apps like Wobot or Ginger were named. They're filling a gap.
Offering therapy.
Not replacing therapists, but offering support. CBT techniques, mood tracking, someone to interact with 247. It makes basic support more accessible.
Okay, so AI is analyzing scans, tissues, even offering some mental health support. How does this change the actual jobs people do?
Yeah, that's the big question. It's not really about jobs just vanishing. It's more about roles changing, evolving.
Like the radiologists you mentioned, they aren't obsolete.
No, not according to this material. They're becoming, the term used was almost like cyborgs. AI does the initial spotting, maybe flags suspicious areas. The radiologist's job shifts more towards interpretation, putting it in context, deciding the next steps, talking to the patient. Their value moves up the chain from just seeing to understanding, cognition.
So human judgment becomes even more critical. Where else is this evolution happening?
Medical coding and billing, that's a big one for automation.
Right. Translating doctors' notes into codes for insurance, complex.
And prone to errors. AI tools, like from ADO, can read those notes and suggest the right codes with pretty high accuracy.
So the human coders.
They handle the really tricky cases, the exceptions. It frees them up, makes the whole process faster, fewer errors, less admin burden.
And reducing that admin burden, paperwork, scheduling, insurance checks, that seems like a win everywhere.
Right.
For administrators, too?
Absolutely. Automating routine tasks lets administrators focus less on paperwork and more on, the patient experience, reducing burnout, too.
So let's picture this, a day in a life. What does it look like for a doctor or nurse in this AI-assisted future?
Okay, imagine a doctor seeing a patient instead of clicking through screens half the time.
Which happens a lot.
Yeah. The AI has already summarized the patient's history, maybe highlighted changes since the last visit, even suggested key questions based on current symptoms.
So the doctor can actually look at the patient, listen more.
Exactly. More time for eye contact, for empathy, for the human connection that's so important.
It's almost like AI enables more humanity, ironically. And for nurses.
For nurses, AI acts like a vigilant partner, almost a sixth sense.
Ow.
It constantly monitors patient data streams, vitals from monitors, maybe wearable sensors, info from the electronic record. It looks for subtle signs of decline, things a busy nurse might miss initially, like an early warning for sepsis.
And it alerts the nurse.
Yeah, pushes an alert to their tablet, perhaps. Check on patient in room 3B, sepsis risk elevated. It doesn't replace their judgment, but it gives them crucial early warnings.
Okay, this paints a pretty clear picture. So pulling it all together, what does this mean for you listening, whether you work in healthcare, you're studying, or just a patient?
Well, it clearly means new skills are needed and new roles are popping up. The sources mention things like clinical AI specialists, people who help hospitals actually use these tools effectively, AI ethicists, ensuring fairness, avoiding bias, even AI trainers, clinicians helping to label data, teach the AI.
So it's about blending that medical knowledge with a real understanding of the tech.
That's the key takeaway, really. AI is a tool, a powerful one. The future belongs to the people who learn how to use it well.
So AI literacy is becoming essential.
Absolutely. Understanding what AI can do, its limits, how to question its output. For students now, data, ethics, tech, they're becoming as fundamental as anatomy.
So the takeaway is the AI revolution isn't some far-off thing. It's here. It's happening now.
Yeah, and understanding it, preparing for it, developing that AI literacy, that's how we can shape it. Build a future where this tech genuinely helps us all live healthier lives.
Leaves us with that really sharp quote from the material, doesn't it?
Oh yeah, which one?
AI won't replace a great doctor.
But a doctor using AI will replace one who doesn't.
Definitely something to think about.